Back pain is one of the most common health problems in the world, and chances are that if you clicked on this video, you've either experienced it yourself or know someone close to you who has. The discomfort can range from a mild nagging ache to an excruciating sharp pain that makes even the simplest activities unbearable. What makes the experience even more frustrating for many people is not just the pain itself, but the process of seeking medical help. A common story goes like this. Someone develops low back pain, visits a doctor full of hope for answers, only to be told to rest, take some pain medication, and come back weeks later if the pain persists. This cycle can leave people confused, disappointed, and still in pain. In this video, we're going to flip that frustration around. Instead of leaving you with vague advice, I want to walk you through how doctors actually think about low back pain. I'll also share with you 7 worrying signs that healthcare professionals look out for, signs that suggest back pain might be more than just a pulled muscle or strained ligament. These red flags don't mean you should panic if you experience one, but they do mean that your doctor may need to investigate further to rule out more serious conditions. Low back pain is incredibly common. In fact, studies show that about 4 out of every 5 people will experience it at some point in their lives. For some, the cause is obvious. Maybe they lifted something heavy the wrong way, or perhaps they twisted awkwardly during a workout or a sports match. For others, the pain seems to come out of nowhere. One day they are fine, and the next they can barely bend over to tie their shoes. Whatever the trigger, back pain has a way of interfering with daily life. It can prevent people from working, stop them from socializing with friends, and make ordinary activities, like walking or even sitting comfortably, feel like a challenge. The good news is that the majority of back pain does get better with time. But the real question people have is, when should I worry? To answer that, it helps to understand that the causes of back pain can be divided into 2 broad categories. On one side, there's musculoskeletal back pain, the kind caused by strains, sprains, and injuries to the muscles, joints, ligaments, and discs in the spine. On the other side, there's pathological back pain, which is the term doctors use when the pain is being driven by an underlying disease process, such as infection, cancer, fracture, autoimmune disease, or nerve damage. Distinguishing between these two is the central task of any physician evaluating a patient with back pain. To better appreciate how complex this is, let's briefly review the anatomy of the lower back. The backbone is not just a column of bones stacked one on top of another. It's a highly sophisticated structure made of vertebrae, intervertebral discs, nerves, ligaments, muscles, and connective tissue, all working together to provide both support and flexibility. The vertebrae form the core bony framework, and in between each vertebra lies a disc, which acts like a cushion or shock absorber, allowing for smooth movement while protecting the bones from grinding against each other. Running through the spinal column is the spinal cord, a thick bundle of nerves that serves as the communication highway between the brain and the rest of the body. From the spinal cord branch out smaller nerves that pass through tight spaces between the vertebrae to reach the legs, organs, and other tissues. Surrounding this entire structure are muscles, tendons, and ligaments that provide stability and movement. It's a marvel of engineering, but also a delicate system. When something goes wrong in this system, pain is often the first symptom. In the case of musculoskeletal back pain, it is usually caused by a strain or injury to one of these supporting structures. Because the lower back is so densely packed with nerves and tissues, even a relatively minor injury can trigger severe pain. This type of back pain is by far the most common and, importantly, the one doctors worry about the least. That's because most musculoskeletal pain improves with rest, physical therapy, stretching, pain management, and above all, time. Sometimes a physiotherapist can even identify posture problems or muscular imbalances that can be corrected with targeted exercises, giving patients a long-term solution. But this brings us to the crucial point of the video. When should back pain raise concern for doctors? When do they stop thinking this is probably a strain and start considering a more serious diagnosis? That's where the 7 worrying signs come in. These are red flags that suggest the possibility of a pathological cause of back pain. And while these conditions account for only about 1% of all cases seen by family doctors, missing them can have serious consequences. The first sign doctors look for is the duration of the pain. With most musculoskeletal back pain, patients start to notice gradual improvement within days or weeks. Even if the pain doesn't completely disappear, it usually follows a pattern of ups and downs. But if the pain persists beyond 6 weeks without significant improvement, this raises a red flag. Prolonged pain may mean that there is more going on than a simple strain. Conditions such as spinal infections, cancers, or autoimmune diseases can cause pain that lingers far longer than the usual recovery period for muscle injuries. The second sign is progressive worsening of pain. In typical musculoskeletal back pain, the severity tends to fluctuate. Some days are better, some are worse, but overall there's a gradual trend toward recovery. Pathological pain, on the other hand, tends to be relentless. It doesn't let up and often grows more severe over time. If a patient describes their pain as steadily intensifying, especially after weeks of discomfort, doctors become more cautious and investigate further. The third worrying sign is the presence of fever or night sweats alongside back pain. While rare, infections of the spine do happen. They are more likely in people with weakened immune systems, those who inject drugs, or individuals living in areas where infections like tuberculosis are common. If fever or unexplained night sweats occur with back pain, it's a strong clue that the pain may be linked to an infection that requires urgent treatment. The fourth sign doctors worry about is new back pain in people over the age of 50. Aging naturally increases the risk of conditions such as fractures and cancer. Women in particular face an elevated risk after menopause because of the loss of bone density, a condition called osteoporosis. Even minor injuries can lead to fractures and weakened bones, and cancers become more likely as people grow older. So new onset back pain in this age group always deserves a closer look. The fifth red flag is unexplained and unintentional weight loss that accompanies back pain. Weight loss can be a symptom of cancer, which sometimes begins in the spine or spreads there from other parts of the body, such as the prostate. When cancer cells spread, they consume energy at a rapid pace, leading to weight loss even if the person hasn't changed their diet or activity levels. This combination of symptoms, back pain plus weight loss, is a sign doctors take very seriously. The sixth worrying sign is severe stiffness of the spine, particularly in younger people. This can be an early indication of a condition called ankylosing spondylitis, an autoimmune disorder in which the body's own immune system attacks the spine, causing inflammation that eventually leads to fusion of the vertebrae. Over time, this reduces flexibility and can make even simple movements difficult. Diagnosing this condition early is important because with proper management, the progression of stiffness and fusion can be slowed down, preserving quality of life. The seventh and final red flag is evidence of nerve injury. This can present in different ways. In severe cases, patients may experience loss of bladder or bowel control, numbness around the buttocks or genitals, or complete inability to move certain muscles. In less severe cases, it might show up as tingling, numbness, or weakness in the legs. These symptoms suggest that the nerves branching from the spinal cord may be compressed or damaged, often by a herniated disc or, in extreme cases, direct compression of the spinal cord itself. Mild cases may improve with physical therapy, but severe compression requires urgent medical intervention, sometimes even surgery, to prevent permanent damage. Now, it's important to emphasize that having one of these signs does not automatically mean something serious is going on. Research shows that these red flags are not perfect predictors, they sometimes give false positives. That's why the presence of a red flag should be seen as a reason to seek medical evaluation, not as a reason to panic. A skilled doctor will take your history, perform an exam, and order further tests if necessary to rule out dangerous causes. For many people, back pain does not resolve within a few weeks, but also does not turn out to have a pathological cause. This is what doctors refer to as chronic back pain. In these cases, the problem often starts in the back, but gradually changes the way the body processes pain signals. Over time, the nervous system becomes more sensitive, amplifying pain beyond the original injury. Chronic back pain is complex, frustrating, and challenging to treat, but it's different from pathological back pain. Understanding this distinction can help patients set realistic expectations and work with healthcare providers on long-term management strategies.